Good morning, everybody. Welcome to the Pacific Health Information Network webinar series. My name is Michael Langley. I'm from the Secretariat of PHIN, and today I have the pleasure of bringing to you a presentation entitled Understanding Digital Health Capability in the Pacific, using the National Digital Health Profile and Maturity Assessment Toolkit, otherwise known as DHPMAT. Now, content for today's presentation is to look at the rationale and methodology of the toolkit, how to assess the national digital health maturity, user perspectives on the toolkit from Kiribati and Niue, and we'll have a discussion at the end. And this webinar is for anybody who works in health, digital health, and computer and information science, or is interested in digital health as a career. And our presenters today will be led by Professor Xiaotiang Liu, who's Director of the WHO Collaborating Centre on E-Health, Full Population Health at the University of New South Wales in Sydney, Australia. Mr. Tarao Bawia, Chief Information Officer, Ministry of Health and Medical Services at Tarara, Kiribati, and Dr. Leroy Tatui, Principal Dental Officer at the Niue Fu Hospital, Lofi in Niue. We'll also be supported by three facilitators: Katri Contio, who's the Technical Officer for Health Information and Digital Health at WHO in Suva, Dr. Samira Ansari, who's a from the WHO Collaborating Centre on E-Health, and Mr. Lara Vivas, who's an Honorary Advisor with Pacific Health Information Network. Now, before we begin, I just ask you to follow the usual housekeeping rules, to mute your microphone if you're not speaking, and we suggest to turn off your video if you want to save your bandwidth. And you can ask any question in the chat function, and you'll also be able to bring those up at the panel discussion. And we will be recording this session, and we will distribute it as per the list that you would have got this information from in the first place at a later date, hopefully in the next couple of days. So at the end. Okay, I'm going to unshare my screen and hand over to Dr. Teng. Thank you.
Thank you, Michael, and good morning, good afternoon, everybody. I'll just share my screen. Can you see my screen now?
Yeah, we can.
Okay. I guess for everybody's, the background for this digital health maturity assessment is a project that we've started with WIPRO, the regional office for WHO, and the Department of Pacific Support over the last couple of years. And a number of the countries, sorry, can you hear me without any echoes or anything like that? Just
we can. Just could
okay,
all people please mute their microphone if they're not speaking.
Okay. All right. So the background is that the project's been going on. We went through a process of co-creating a digital health profile for a number of Pacific Island countries, and started on the process of assessing the digital health maturity. And we're sharing this experience with you today. So that's how we came about to do this presentation today. So what we like today is do some welcome, which Michael has done. And perhaps I think it might be really useful, since there's only a small number of attendees, to do some introductions. But what we like today is to really go through what digital health maturity assessment is all about, and then share experiences from Kiribati and Niue, how Kiribati did it and how, why Niue did it and how. And then we'll come together as a group to discuss and to answer questions on what the next steps might be. And then we'll wrap up. So just wondering, Michael, is it okay if we spend about a few minutes just do some introductions? Of
course, Dr. Ting, we have plenty of time.
So I've got on my list here, Meslami Namadre. I hope I've said it right. Would you like to kind of briefly just say where you're from and what you do?
Yeah, sure, Dr. Teng. I go by Mesu as well. I'm a medical doctor by profession, but I'm currently working with World Bank Health Team based in the Suva office.
Thank you very much. Laura, I guess you probably don't need any introduction, Laura. Can't hear you.
You're muted, Laura.
Sorry, Laura Vivas. I am based in Canada, so good afternoon. Thank you.
Next one is Michael Butsworth.
Oh, hi, Teng. Yeah, nice to hear from you again, and I'm glad this work's come along nicely. Yeah, I'm Michael Butsworth. I work with WHO in Vanuatu in health information systems and health systems.
Good to meet you. Then the next one we got is Niue Pho Hospital.
Hi everyone, it's Leroy Tattoo here from Niue. As you saw in the earlier introduction, I'm the principal dental officer, so a dentist by profession. I look forward to the discussions.
Thank you, Leroy. Next is Alexandra.
Hello, my name is Alexandre. I work as a business analyst for the Ministry of Health of French Polynesia.
Thank you. Katri is next on the list.
Yeah, hi everybody. I'm Katri from WHO Technical Officer working for the Health Information Systems and Digital Health from SUA office. Thank you.
Thanks, Katri. Next we have Samira.
Hi everybody, I'm Samira Ansari. I am a postdoctoral researcher. I work at the WHO Collaborating Center for eHealth here at UNSW in Sydney with Professor Teng and colleagues. Looking forward to our discussion today.
Thank you, Samira. Next, we got Vicky. Vicky Bennett.
Hello all, I'm Vicky Bennett. I work for the Australian Institute of Health and Welfare, and I am an advisor to the FIN.
Thanks, Vicky. Christine Bishop.
Hi, Dr. Tan. Hi, everybody. I'm Chris Bishop. I'm Digital Health Innovations Team Lead for an ADB project in the Central Asian Regional Economic Communities and Caucasus countries.
Thanks, Christine. And I'm Dan Ledzinski. I'm sorry if I pronounced your name wrong.
No stress. It was terrible spelling that I was given at birth. So my name's Diane. I'm part of the Beyond Essential Systems team. And we've got a few softwares that we're rolling out in Pacific countries at the moment.
Thanks, Diane. And finally, I'm not going to try this, Rovoadro. RVUADREU. Guess it's an acronym of some sort.
No, it's Rudy Von Dreu.
Ah, okay, Rudy Van Dreu. Nice to meet you. Hi, and you're from? Okay. Kiribati, we got Kiribati, have we? Kiribati? MH.
Sorry, Teng, that was me, it's Vicky. That's Rudy is from Fiji, so she might not be able to get on her microphone.
Okay, all right. And we got.
Hello.
Hi.
Good morning, everyone. This is from Kiribati, myself, Tarau, and HIU, Arieta team, the HIU team, Arieta and the HIU staff.
Thank you, Tarao. Giovanna, WHO.
Hi everyone, I'm Giovanna. I work for the global Go Data team in SKU, but at the moment I'm deployed to the WHO Fiji. I work with Catherine on Go Data deployment in the Pacific. Over. Thank you.
Thank you. And finally, Tamong Udui. Sorry again if I got it wrong. From Palau, I think.
She said that she doesn't have a microphone, but I can represent her, she's an epidemiologist, a chief epidemiologist from the Palau, and key in implementing digital health tools for the contact tracing and surveillance.
Thank you. I think that's my list. Have I missed anybody? No. Okay. Well, thank you very much. I think that's really helpful. It helps us to know who are the skills, the experts we got here. So a few technical data people, and I guess relevant people, and WHO people. That's great. So shall we start now? So what I'll do, I'll give you kind of summary in as short as possible time, maybe 5-10 minutes, and then we'll get to the nuts and bolts of this, which is what we did in practice in Kiribati and Niue. So I'll basically talk about some of the logic behind it and why we're doing it. We actually published some of the work in the journal, in the peer-reviewed journal, and if you are interested, just let me know in the chat and I'll send it to you. This done with the colleagues in Wipro. So that's some of the background work, so you can get more details there. So why? Number one, I guess it is in terms of health services. So we want good digital tools and data for integrated person-centered health services. Okay, it's a bit of jargon from WHO, but very meaningful jargon. So the health services essentially needs to be high quality, needs to be accessible, and preferably equitably accessed, and need to be cost effective. Obviously, we haven't included things like provider well-being and satisfaction, and consumers and patients' well-being and satisfaction. But from the digital health perspective, these are some of how we can look at digital health is being used at different levels within the community in the country. So we look at individuals, families, and communities, and some of the digital health things that they are involved in would be EHRs, wearables, sensors, mHealth. Okay, so trying to build a picture of the ecology that we'll be dealing with in this digital health maturity assessment. Obviously, the health service providers are very important because we use EHRs, we use decision support systems, e-pathology, e-prescribing, e-radiology, and so on. At the health organizational level, we talk about, again, the EHR and the EMR. We talk about telehealth, telemedicine, teleradiology, teledermatology, and so on and so forth, including e-referrals and e-prescribing. And then at the health system level, we need to have a big picture, helicopter view. We need data, good data, right? Web-based reporting services and for facilities, real-time reporting preferably, and big data analytics. So it's kind of that's the range of things that we're looking at now and where we're aiming to in future. So it is important to know where we are now, which is what the maturity assessment is all about. All right, so that at the end of the day, we can provide good integrated person-centered health services. So the next reason why is at the population level. We need good digital tools and data for quality improvement. Okay, so we need it for health system reporting at the regional level, national level, and international level. So we think about the quality of the data and the interoperability of the data. So the data life cycle is represented here. All right, so talk about data entry, data creation, data storage, data management, extraction, the analytics, and reporting and display. All these are part of the essential health foundations for digital health maturity assessment. So those are the two key reasons, I guess. So I'm just trying to summarize maturity assessment into this one figure. So bear with me, I've spent a little bit of time. You will recognize the middle bit of the figure. And that's what it's all about. Providing good quality, safe healthcare services that's cost effective. All right, supporting that. All right, digital health tools in practice. Now, at the bottom, underpinning all these are essential digital health foundations. All right, we need the ICT infrastructure. We need essential digital tools. Some of the tools are mentioned up here. You need a good health data exchange. This is where enterprise architecture and interoperability and good quality data is essential. And obviously, how do we support adoption and use? So the regulatory environment, the capacity building, and obviously the resources available. So these are the 4 essential digital health foundations. And there is a 5th foundation running through all of this, all right, which is basically do with quality monitoring and quality improvement. You can look at it from each of the individual foundation, the 4 group of them, and QIMME is essentially quality improvement, measurements, monitoring, and evaluation, which is another term that we use in WHO. So I'm talking to the converted here. So so if you've got any questions in terms of the acronyms and to for clarification, just let me know. So there'll be performance indicators in the maturity assessment of your digital health foundations and how ready you are to actually implement digital health intervention, digital health program with good likelihood of success. So at the end of the day, and having done all that, looking at that, there's also needs to be a feedback loop to improve the data quality and obviously to improve the data interoperability. So that's the environment within which we talk about digital health maturity. And so the final part of this diagram is digital health maturity levels. And there are 5 levels. And it goes from basic, where everything is uncontrolled, and I'll go into more details in this in the next couple of slides. Basic, control, standardized, optimized, and innovative. So just these are the terms that we use in maturity assessment with this particular tool. So more details about that. So another look at the same diagram. All right, these are the 4 essential foundations. All right, the infrastructure, the essential tools, the knowledge exchange or information exchange, and the health system adoption factors, and obviously the quality improvement. So this give you a bit more detail about the levels of maturity, okay? So at level 1, you're basic. The system is unpredictable, all right? There's no knowledge sharing, you basically can't rely on it. Level 2, you're getting a bit more control, all right? Processes and the system is starting to be getting predictable, but you're still fairly reacting to the problems and you're still problem driven in the way you approach it. So reliability is getting better. And then level 3 is standardized. There's standards for best practice and standards for the data standards and the metadata standards. The processes are getting consistent, and there's starting to be level knowledge sharing in the organization. And you're starting to look at addressing the requests and from the people in the organization for the different units. So this is the system, the digital health system, and you're starting to respond in a standardized way. And the system is actually starting to work in a standardized way reliably. So this is probably the baseline, okay? But we need to think about all these other things and all these other levels of maturity. And the next level is you're starting to, once you're really standardized and getting predictable, the system's getting predictable, you start to think about quality improvement, right? There's continuous quality improvement, efficiency, processes, improving the cost effectiveness of the processes, and there's starting to be cross-organizational knowledge sharing. So in between your organization and other organizations doing the same thing in the health sector. So you're starting to develop accountability and improving the quality of a service. And finally, having achieved that, or it can be parallel processes, you start to be innovative with what you have. Okay, you start to develop values in your system, and the way you implement it for sharing across the enterprise, industry level knowledge sharing, and you start to drive innovation. So this is kind of essentially, basically a quality improvement cycle from basic to innovation to innovative. So that's what I guess maturity assessment is about. It is a quality improvement process and exercise. You know where you are at, and you start to develop your goals to get to the next level, because they're kind of categorized to allow you, say, 12 months to actually get there if you have a adequately resourced and adequately staffed program. All right, so this is kind of the overall picture of what maturity assessment is about. It is a quality improvement exercise. I'll give you some examples in the next slide. So you'll see the basic levels, 1, 2, 3, 4, 5, all right? From red, right, really dangerous time, right up to blue skies, right, in level 5. So example might be looking at accessible and internet and supply chain, but in basic levels is unreliable. So you can assess it from that perspective. And at the other end of the scale, the reliability improves. All right, you start to can support services, and the supply chain is reliable, and so on. So, and you start to be able to depend on the system to allow you to improve your quality and to innovate. Same thing with the tools, and the tools include, like, for instance, I've mentioned here, unique ID, social media, health information systems, mHealth, and telehealth. So one example would be, telehealth. At this point in time, with the relevance of COVID, we use a lot of telephone as telehealth. But at the end of the day, we want to get into video conferencing and integrating with our EHRs. Sorry, this is EHRs, and starting to incorporate decision support while you're doing a telehealth consultation or virtual care. So the maturity goes from telephone-based to virtual care and innovating with virtual care. Similarly with the information sharing, which is, I guess, one of the hardest part of maturity assessment and maturity quality improvement, is sharing data, sharing good quality data. All right, within the organization, across the organizations within the country, within the health system, and so on. So you go from standalone data sets without any terminology standards, partly because of ease of use, and right through to standardized terminology, WHO ICD-10, now nice ICD-11 at a national scale, and you start to quality improve your policy and practice using data-driven experiments and so on to test whether your policy or your practice is working. And you have a common data model nationally, all right, so that you can actually start to talk about data linkage and link all the data to use the data effectively for innovations. And obviously the final part is, the fourth part is the regulations. For example, like digital health regulations. Obviously, security and privacy is very important, but there are also things like AI legislation and so on. If you want to start to use the data and develop data-driven policies and practices within your country. And it needs to be facilitated by legislation, capacity building programs across all the sectors, and so on, and good governance structure, apart from the legislation, to implement and to put into practice the various regulations. Finally, obviously, you need to have an inbuilt quality improvement program, all the way from basic to innovative levels of maturity, so that you can actually use the lessons or the experiments or the work that you've done to take you to the next stage without losing what you have, but building on what you have systematically and logically towards the end goal, which is an innovative, value-driven health system. So that's kind of the basic principles of digital health maturity assessment. The essential health foundations, it is a quality improvement exercise. And you set goals according to this maturity matrix here. Okay, so hopefully, I mean, so we've used this with a number of countries already. Some of you have been involved in the digital health profile creation and the digital health maturity assessment based together collaboratively with us to work through where you sit in this matrix. So potentially the next stage which we have embarked on, we will be embarking on, is to use once you've done your maturity assessment, what do you do with it? Okay, you go through a process of validating the assessment with a larger group, all right, a multi-sectoral group, and you facilitate the implementation of the development of a roadmap for your digital health strategy based on your digital health profile and your current digital health maturity. All right, so you validate and you facilitate that process, and then you decide on what your roadmap is going to be based on your national health priorities. So we won't go to that because it is a quite busy slide, but the example here is a country wants to improve access to health services using digital health. So form a working group to analyze the current state, which is what we have just talked about, the maturity, using the maturity assessment tool as an ongoing assessment and planning tool to facilitate its work and to monitor and evaluate. But that's the broad phase that we're going to be implementing over the next little while, hopefully. But what I'll do now is stop and invite Tarao and Leroy to discuss the experiences with what I've tried to describe in the past few minutes. So if I can call upon Tarao to share his experience with the process and from his experience at Kiribati. But this is what we came up with, and I'll let Tarao talk to it. Thanks, Tarao.
Thank you, Professor Dr. Ching, and good morning, everyone from Kiribati. Can you hear me well from there?
Yes.
Okay, maybe I'll go through some of the what we experience in when we assess our current digital health. So we go through the basic assessment with Dr. Ching and Dr. Samira, and we see that it is very important for us to get those the digital health to have the digital health framework and to have that digital health foundations to where we're going to build our digital information, because right now we we are in a transition form, or we are now going to transform from a more basic paper-based to a more electronic system. So we are planning to do that one. And as you can see, everything is seems to be at a very basic level in terms of those health foundations. So we see it is very important because it is more like a guideline for us in our digital roadmap, and it's gonna guide us well toward what we will achieve at the end of in each progress. So we go through the assessment with the HIU unit, and we invite, how we do it, we invite the HODs, the executive management as well. When we find out that we need to have one thing that is mentioned over there is the unique ID, the unified health information identifier for all the patients. So we have we run that kind of workshop with the HOGs to get their thinking around that one, and also we able to identify some of the gaps that are mentioned in the health, in the foundation. I mentioned the foundation, the 5 or the 6 foundation in the health maturity assessment. And we have a project with the World Bank on connecting all the clinics and hospitals, and we hope that using this maturity assessment, it's going to guide us well in our transformation, and also if this can be used in other Pacific countries, then we can all work together to compare and see how one country is progressed from one stage to another. And that is what we hope to accomplish with this assessment over the years, the coming years. That is what I can share from here, Dr. Chin, because we are basically at a very low stage, but we hope to progress well with this assessment over time. Thank you.
Thanks, Leroy. And I think, it's important to be honest, but honest, in how you actually assess yourself. But I think as we discussed, it's always good to underestimate yourself, right? It gives you more room to actually work to improve yourself. It makes your job a little bit easier if you kind of set the bar a little bit more realistic. So I just pause here to see if there's any questions from any of our participants in the webinar. In terms of information, we'll discuss it at the panel at the end, but I think if any clarification of anything that you'd like to happen here before we go on to the next, to Leroy, to share his experiences from Kiribati. Sorry, from Niue.
Yes, look, it's Michael here from Fin Secretariat. Leroy, just pardon my ignorance, but I just wonder if you could give us a very brief description of the current status of digital health in Kiribati. Like, if I were to walk into your hospital, what would I see in terms of digital health?
Okay, I will let the HIU, the OIC editor, to contribute on that one.
Actually, while the Taro's team is getting ready to talk, Samira, maybe you can show up the spreadsheet, share the screen on the spreadsheet of the digital health profile for Kiribati.
Yeah, I think that would be great if I can, Samira can share that one. But I think what I asked the question. Michael, are you asking for the what question?
I just trying to get an overview of the state of digital health capability in Kiribati at the moment, just so I've got some sort of benchmark to know. You say you're at basic level, you know, does that mean, you know, that you have no electronic PAC system for, you know, looking at radiology, you have no connected database for patient records, or what? You know, just trying to work out, you know, where you are now and where you might hope to get to using this roadmap, just to try and link it back to something a bit more concrete.
Yeah, I understand. One thing that we call it more like a basic, because we have maybe we can say that we have different databases used in different departments, and we don't have like a unified health or maybe a patient ID that can be used to identify each patient in each database. So that is the problem that we have. In some cases, we have like the M supply is used for the pharmacy, but the patient that are using the pharmacy maybe have a different identifier from that one compared to the one in the radiology. So it's more as no centralized, so that we call it a basic. But even though we try to connect all of the clinics, but the thing is that we don't have, we can't match or we can't link this data because there's no common identifier between the all different databases. And that is one case that we have. And we will try to work on improving this by establishing our patient ID more on our master patient index, so that we can have those databases link and connect by having this identifier to map everything out. And also we have a plan to connect all the clinics. Yeah, I think that's what we are planning to do right now, if it answers your question.
Yes, thank you.
Okay, any other questions? I think if you look at Kiribati, Michael, they actually have a lot of information. We got a lot of information, like I'll just share with you some of it. Maybe some of the things that if Samira can go down to what Michael just said about in the hospital, the EHRs that they use and the tools that they use. So go into the tools section here. So you look at in terms of this is a spreadsheet just to explain to the participants. The headings are, these are some basic questions asked, all right? In the different areas, like what government primary care facilities use, or EMR and EHR, hospital facilities use, and a bunch of these indicators. There's about a few hundred indicators that we go through, and we kind of get a gestalt of where they sit at in terms of the level of maturity under the broad group. But obviously there are a lot of details underpinning the assessment of the maturity. So once we start to take it to the next step, we can actually start to move within each basic foundation and work out which are the areas to focus on, and work out as an intersectoral group, in the country, which are the ones that's most likely to need to be done, but also to meet to relate that to the national priority, and relate that to the level of maturity, which is the staff you have, the resources you have, the infrastructure you have, and so on and so forth. Okay, so there are lots of details underpinning the assessment of the maturity. Does that make sense to Michael and the rest, I guess?
Yes, thank you.
Okay, so all right, yeah, any others comment, any other questions or facts? Okay, can we move back to allow me to share screen again? Sorry, can you see me now? Can you see the screen now?
Yes.
I really shouldn't muck around with this sharing screen business, wasting a bit of time. But okay, if there are no more questions for Tarao, why don't we go on to Leroy? As introduced, Leroy is the principal dental officer at Niue World Hospital. Thanks, Leroy.
Thank you, Teng. Yes, again, Falafatu and Pacific greetings to you guys that are tuning in. Before I start, I'd just like to acknowledge Teng, Samira, and Kachi for taking me this process of assessing the digital health maturity for Niue. Being a clinician by profession, I guess I could say we're talking from the health perspective, health provider perspective as the end user of digital health. So it was really useful getting that support, because I guess it was kind of technical, but they guided me through the discussions, and here we are now. So we did this assessment in November, end of last year, November, December, and we validated earlier, not validated, but we went through again beginning of this year to update some of the information. So let's just start off with a bit of context for all of us here with the infrastructure. Now, when we had digital health introduced in Niue in roughly early 2000s. By 2005, they adopted the MedTech 32 system, which is something that was introduced to us by our New Zealand counterparts. And that is the same system that we have been using right up until now. At that time, when it was implemented, I was told that they had some problems and barriers due to the infrastructure. The system at that time in the hospital maybe did not meet the technical specs of the software, MedTech 32. In addition, there was an aging workforce, and so the uptake or the buy-in for the use of MedTech 32 was relatively poor. Fast forward to now, there's been some improvements in the infrastructure, especially related to the connectivity. Niue has upgraded to 4G and are planning to upgrade further in the near future with the Manatua cable. But at this stage, we have a young workforce that are pretty much enthusiastic or very keen to use digital health in terms of how we deliver our health services. So in that sense, the health maturity levels for Niue was ranging from pretty much level 1 basic and controlled. Okay, so with the essential tools using MedTech 32, we have electronic health records and health database, but at the same time, we still refer to the old system of the manual-based paper recording. And the reason being is that sometimes we have unexpected power cuts, and in that instance, we didn't have backup to the health information system, and in that moment, we are required to go back into the paper system, entering manual data into health folders and prescriptions as such. But when the power comes back on, we fully use the health system. So there was a bit of a discussion going around then when we did the assessment on whether we fell in the controlled or basic level for health tools. So yes, we agreed on basic for those reasons. For health information sharing, it was also there was no defined boundaries in terms of the Niue context, mainly because we are not really extracting the information from the MedTech 32 platform, which we can, but I think there's just lack of training capacity for staff to do that. So we still refer to the old Excel, and then from there we process and analyze information in terms of Excel charts and sheets and share accordingly. But we still manage to classify that as controlled. So the adoption, as I mentioned before, we had a pretty aging workforce, and the engagement at the early stages, I'm unsure of, but I heard that there was slow buy-in and resistance by the staff to actually use the software. So along the lines, they had some training and support from the admin team, and then now we are using it more, and we're more aware of when problems happen and how to I guess flag it and let our support system know. Just a bit of information: the health information system is not entirely operated within the hospital. We depend on our telecom company to actually set the hardware and software and the basic maintenance. So we, as the health providers, are just end users. For quality improvement, we summed it up as still in developing phases. We're still in very much primary phases of using this digital health as intervention. So it's really timely that we had carried out the assessment, and it's established the benchmark for what we have now, and also give us a view in where we want to head to, some sort of direction in where we want to head into in the near future. So yes, I hope I summed that up pretty well. If you have any questions, I'll let Teng take over now. Thank you.
Thanks a lot, Leroy, and thanks, Tarao. I guess it might be a good idea to move on to the panel discussion, and I guess we can start off with all these questions about how it actually worked in Niue and Kiribati as part. So why don't I introduce the panel first, and then we will continue from where we left off. So the panel will include Tarao, obviously, and Leroy, obviously, Lauro from the Fin, Katri, who's, I guess, the driving force behind this, and myself. And I guess Samira and Michael can chip in, or any of you can chip in anytime you like. So why don't we start with some questions on, on the presentations by Leroy and Tarao, because I think that's where I think we need to get our heads around. Okay, over to you, all of you, really, to start.
Dr. Tang, can you, is it possible to remove the PowerPoint so we can all see each other?
Yes, I will do that.
Okay, great. Thank you. Great.
Great.
Thank you.
Can you see each other now?
Yep, I can. Yeah, thank you. Dr. Tang, before, well, first of all, what happened? Oh, sorry. Thank you very much, for all of this. This is very helpful. And Kiali, Tarao, Kiali, Leroy, thank you very much as well for participating and sharing your experience with this. But I do have a question, though. I mean, this is a very good snapshot of where the countries are in terms of their maturity. But I would like to know, how does this tool explain how they can get from level 1 to level 2 and level 3 all the way to level 5? So what is the path to maturity, or is that a different study? So that's my question. Malo?
Thanks, Lauro. Tarao, Leroy, do you want to give a practical answer?
Okay, let me just share my answer for that. I think it depends a lot on a lot of factors. I can speak for myself. I say it takes maybe a bit of political will to prioritize, digital health. We are a small health system here in Niue, so there's a lot of competing interests, and yeah, I certainly think that maybe that's an important part of getting past the stages of maturity. Yep. I hope that answers your question, Laura.
Yeah, I think so. Yes, for sure. Yeah.
Any thoughts on that, Tara, from your perspective?
Thank you, Dr. Ching. Yeah, from our side, I think the assessment is when we think of the infrastructure, what we currently have, and then moving onto the systems that we're going to adopt. Because there are a lot of off the shelf and like what we call the open source systems or whatever that they can what they call some people say that it's a low lying fruit or something that you can pick up or something that we can take. So what I have from here is that when the management understand that where we are currently have at this stage, and when we assess ourselves based on the software, on the infrastructure that we have in the next phase. That is how I see it from myself. When, like, for example, we don't have a common system to use, then maybe after we connect every clinic and we connect every hospitals, we can think of the application or the software that we're going to use in our network, and that is where we can reassess ourselves after we complete with the infrastructure to see where we are, and the foundation is going to be like our checklist to see what are the things that are being checked and what are the things that we need to improve on, because it's more like our guiding parameters to our assessment. If that's answer the question.
Okay, thank you,
Thanks,
Tara.
thanks, Tara. And I guess, to sum up the thoughts from Tara and Leroy to some extent, but I think the way this thing was developed is that if you look at the 5 levels of maturity, so, it is a very high level functional level of maturity. So you start off thinking high level and you come down to be more specific. So the high level is that firstly, you need to be predictable. You need to be able to address your problems. All right, that's level 2. And then you need to be able to address requests from people who are using your system. That's level 3. And to respond in a standard manner so that they expect a certain level of quality from you, from the health system, the digital health system. And the next level is you are actually optimizing your system. All right, you're actually trying to improve your service. Okay, and so that's kind of that 4 levels to level 4. But once you've actually got a good functioning service, providing good quality service, safe service, accessible to most of your people, equitably and so on, and provide good outcomes, and in terms of your health outcomes as well as your digital health outcomes, you can start to innovate. All right, and you got all the data if you're actually following all the 4 essential foundations. All right, especially the standards-based, the readiness for information sharing. You can start to improve your models of care. All right, and use data that you generate yourself to improve your model of care. All right, which will be hopefully, designed for bottom up from the community, and the organization, rather than being imposed. Obviously we need to share internationally and nationally, internationally to share the best practice models. But that's where the data from each individual country will actually help the adaptation to improve the local situation. So you start up from a functional definition, and then you break it up into the essential foundations, and you work out what are the ones that might be the barrier, the biggest barrier, the lowest. But you also use this breakdown to actually to decide on which are the easiest or the most appropriate barrier, in terms of not just addressing the priority you're going to be addressing, but also what's easiest, so that you don't lose heart. You try and take on too difficult tasks, you struggle. So you actually can systematically kind of choose the lowest hanging fruits and work upwards towards your end goal. And your end goal might be depending, like say, if you're looking at from basic to control, might be different from you're going to go from basic to standardized. So it's giving you a reality check. All right. So I think that's the beauty of this kind of a fairly simple template. You think broad, but you focus on what you can do well. So, and you think about, and I think one of the things that came out very strongly in the discussions we had with both Leroy and Tarao is the need for an intersectoral or interdisciplinary approach to the next phase. You can't deal with that on your own.
Yes. I have another question, but Vicky actually has her hands up. So thank you very much.
Thanks, Laro. And look, I have to go in 5 minutes, so I'm just going to throw my 2 bobs worth in now because I have another meeting. I guess I'm here. I was just listening to that, and I was reflecting about the Health Metrics Network. If for those of you who've been around long enough, that WHO had running, and all of the assessments they did in many countries that never led to any planning and outcomes. So I guess I'd like to, and that's where we developed that rapid assessment and planning tool for HIS for the Pacific, because we're doing an assessment is vital. But as people start to identify issues, they automatically start thinking solutions. And we tried to sort of, in what we were doing in the HIS side of the world, not only think assessing, but also then planning and linking the two together. Because the planning of what you're going to do next is absolutely vital. And low-hanging fruit is a good phrase. I guess one of the things we did in the HIS planning part there was, and again, intersectorial was exactly what we needed to achieve those things. There's low-hanging fruits, things that are easy to do. Then there's things that you actually sort of like opportunistically, it's a great time. For example, if your public health legislation is currently being reviewed, you might want to prioritize fixing your notifiable diseases list at this time, because it probably won't get reviewed for another 10 years. So even though it's not high value right now, but you've got to pick the opportunities. A bit like the submarine cable. People that, this is a thing that's coming now. So how do we maximize our benefit of those things that are in the environment that are going to help deliver bang for buck at the moment that might not be around later? So I think that's really key, is that doing the assessment, but also having a very structured planning process to start to address those things. I think that's exactly what we learned from the HMN work back a decade or more ago, is that lots and lots of countries did assessments, but then they often, and it took them a long time to do the assessment, and they'd lost the political buy-in because the assessments took so long, and they never actually really got around to actually implementing anything. So everyone knew how poor their system was, but they never really got much benefit out of the improvements that needed to happen after that. And I think that's where, I'd encourage you to sort of roll out these assessments, but make sure that there is a planning process that put in place directly after the assessment, because that's when people's minds are still thinking, oh, we don't have this isn't very good. But actually, human nature is to automatically jump to sort of, how do we solve this problem? And I think I'd encourage, the countries that have done this assessment to think now an actual plan, a strategy to achieve, gains in the maturity and the different aspects of that. Anyway, that's my 2 bobs worth.
Thanks. Very wise words, Vicky. Very wise. There's been lots of lessons learned over the last 3 decades, 2.5, 3 decades of informatics and digital health. Yeah, no, absolutely. We got to translate this into action. But I guess what the maturity assessment tool try to is to give you discrete steps. Don't aim for level 5 maturity. Aim to the next level. And within each step to the next level, there are a lot of things you can do, but that's where your choices come in, based on an intersectoral or interdisciplinary or interprofessional kind of a group looking at it. You know, so it gives you that steps to take, as opposed to, you know, saying, I want to get there, I want to have a fully developed digital health system that's interoperable with across the country, which is, you know, a 10-year, 20-year kind of a vision.
Dr. Ting, could I ask Leroy and Terrell, what will be their next concrete step on their roadmap? What will be the very next thing they will do towards putting the car into gear and driving down the roadway? Maybe I'll ask Leroy first.
Yeah, so we identify as a group the importance of setting a working group. For your information, Niue, our health system does not have any post, say, health information officer, a formal post for that sort of work. So we thought that it would be ideal to set up a working group, and having done the assessment, maybe get in touch with the network in starting discussions around developing a strategy, a digital health strategy. So I guess that's our next move.
Dr. Teng, can I ask? Sorry, can I ask a question? I totally agree with what Vicky was saying. You know, that following an assessment, there needs to be a plan, right? I mean, or else it's just another assessment and nothing happens. But in order to help the countries actually formulate a plan, does this tool provide some prescription on the things that they need to do, and even some ballpark cost? You know, because that is all part of the whole planning process, right?
Yes, this is part of the journey.
Yeah.
All right. The journey at one level is from level, whatever you are at, level 1, 2 to 5, in the broad categories. Okay. And I guess just to step back one stage in terms of the outcome from what Leroy just said, and I think a more realistic end goal in terms of setting kind of things that people can start relatively easy, is actually to develop a roadmap as opposed to a focused roadmap, as opposed to a broad strategy or a broad, because that makes it difficult. You know, the broad strategy can be the one that guides the whole maturity assessment. All right, it will have to be. But I think the maturity assessment tool allows you to have focused roadmaps across all the maturity levels, right? And also across the 4 different the essential foundations. So you can choose that based on what's going to be the most useful to your national priorities, but also what's doable. I think those are the 2 key things, right? First thing is got to meet my national priority, whatever that might be. It could be, you know, telemedicine to improve access to this particular island, or, you know, or this particular community. But what is needed along the way in terms of the essential health foundations to do, to if not achieve it by 12 months or 24 months, you know, whatever is possible, you need to work that out, you know, as a country, what is possible from your current level of maturity to get to that point of focused roadmap, as opposed to saying, you know, I want to develop. But the overall strategy say that, you know, telemedicine for all of the country, you know, for everybody. But you build up the little bits and pieces along the way using your roadmap, and that is based on this maturity level.
But, Dr. Tang, the other question I have though is that, does this tool provide at least some guidance on, you know, some of the specific things that the countries need to do in order to move up one level?
Yep. So yeah, sorry, I got this. Yeah, I didn't finish my answer. We have done a fair bit of, there's a lot of tools out there.
Yeah.
All right, a lot of tools. It's question is choosing the right tool and adapting and being able to adapt it to your local country situation.
Mm-hmm.
So what we've done, we actually worked with USAID and WHO and everything else to just build up and draw on the public goods concept. So there are a lot of resources being developed by very clever people all over the world. All right. Our role with this particular tool in this assessment tool is to know where our current assessment is, our level of maturity is, and what are the tools, what the problem we want to solve, and then we look for the tools to solve that problem. Okay. All right. We don't start with the tools, we start with the problem and where we want to get to. Okay, and the way we want to get to is not just the, say, for instance, the particular examples, but in terms of maturity. So that's why then we look at it in a broad picture. Then you start thinking about interoperability, which is the key problem that we can't address now, but nobody has really addressed properly. And hopefully the Pacific Islands can be a leader in this area, looking at, because it's small and the problems are relatively easier to solve. And then you can scale up. But that's the idea, the guidance that will need to be, depends on the problem defined. And the problems need to define based on your level of maturity. Okay.
Got it. Mahalo.
Yeah, that's right. Does that make sense? I mean, to people on this webinar or on the panel?
Dr. Teng, I would have a comment. This is Kapri. I tried to keep my hand up, to doing according to protocol. Before, I would have a question, like for the other participants. I just said that, I think the value compared this tool, to a lot of other assessments, that have been traditionally done, is that we are looking actually the root causes and foundations, and this is more practical compared, a lot of health information assessments are usually indicator or the output driven, and we are looking more the broadly, like digital health foundations and giving the implementation guide, for the countries. So I think this is more practical tool, and also that given the acknowledgement that a lot of the countries are moving with the digitalization of the health information systems, with a lot of traditional tools, are not taking into consideration at all. They're looking more what would be the let's say, death certification rate in the country, but not looking, what is the cause of the low death certification in the country. So I think that's the one of the beauty of a tool. And the second thing is that it's forced really the countries, the looking these foundational items. I think Kiribati, so Tarao just mentioned, the well that they're now looking, like the building the health identification system in Kiribati. And I think these are the kind of the foundational items that, a lot of development partner agencies are not usually looking with their planning. And a lot of people there tend to go like directly for the digital health tools, like, the offering the EMR system or, like some sort of software solution. And not really looking, like, how to build, the base infrastructure, health IDs. And I think this tool really guides and forced to, as a planning tool, to look, like what needs to come first, before you can, to do more sophisticated stuff. And make those digital health interventions and application actually be functional in the countries. Like you can't really start doing the telemedicine if you don't have an internet connection, for instance. Or the interoperability of tools, like, very difficult, we have faced, some difficulties to try to implement, the tools in the countries without having, like, for instance, health ID. But then I would like to ask, like there's a lot of people with the different backgrounds, there's a vertical people, program people from the outbreak management, but there's also ICT backgrounds and doctors and development partners. And it would be interesting, to hear, for instance, not to putting anybody in the spot, but, like how development partners or, the countries and vertical programs to see, the value of the tool for their own work and programming. Like for instance, World Bank or ADB or the countries that haven't done the tool yet or participated, like a France Polynesia. Is it something that, you'd resonate? Just over to you guys.
Thanks a lot of wisdom there. Any comments on what Katri just shared? Well, while you're thinking, you triggered a number of thoughts in me, Katri. For instance, that launching into buying a tool. I think if you actually know where you are at and know what your profile is in terms of your tools, especially in that foundation, and putting it into context of the other foundations, so that you actually have a system that can interoperate and easy to use. I think that can be also trigger the emphasis away from just buying the systems and doing limited specifications requirements, but really to have this is our need. What are your specifications that you can provide in your system to help us meet our need, which sometimes and often get forgotten in the technicalities. So I think this kind of shift that maybe can help to shift the thinking around in terms of either buying or adapting a system or adopting a system. But I'm just kind of filling in time while I'm waiting for others to comment.
And if I could, just mention as well that I think one of the additional value of this tool is that, as you mentioned, Dr. Teng, that if the country doesn't have or consider the need, or because of the small population, for instance, Niue or some other small countries, that they don't want to go on the road and build, the very comprehensive digital health strategy. This tool, would be to facilitate them to do the, as you said, the digital health roadmap. At least the guide, and prioritize, the activities and look that they are not built on the silos.
Yeah.
And for the countries that already have the digital health strategy, would help, them to prioritize the activities, in the strategy and do, more short-term annual planning. That's how I see
it. Yep. Any other comments from anybody?
From here, Dr. Ching, can you hear me from there? Yes, we see it also from here that the framework will help us. I agree with one of the comment or the one who chat about the, we can use this framework to work with our development partners, to address the, the things that we have and what are the things to have after this, or like a follow-on to our development strategy. So I see it is quite very important for us to, as a guideline and as a way to talk with our development partners to help us through in our digital roadmap. So we have something that we can share with them, and they can also reflect back on our status and how we progress with our development. That is how I see it from here. Thank you.
Thanks, Tara. Any other comments on the process and perhaps even where to next? I think, just in terms of where to next, just to toss an idea in there. I mean, like, for instance, Tarao has started in Kiribati, has started to work on the unique ID. And perhaps they can be in the nucleus around the next steps in terms of developing a roadmap for a regional kind of approach to a unique ID. Just as an example, you know, and then perhaps a different country can do a different part of the foundation, different foundations, and be the kind of the lead. And then you actually start to learn from one another. Oh, well, we all start to learn from one another. I'll shut up now. Over.
I was wondering if anybody, you know, like from the development partners or sustainable solution, you know, like if you would like to comment, you know, like you probably see the tool in the first time. Like for instance, is this, you know, like the tool, you know, like would that help, you know, for the developers, you know, to consider or implement their for deployment strategies in the countries, or thinking about, you know, like what type of products could work?
Yeah.
Yeah, can I come in, Katri?
Yes, absolutely.
Yeah, okay.
Thank you.
So thank you very much for this presentation, Dr. Tang, and running us through the assessment framework, and Leroy and Tarao for taking us through how it's used practically. I think for me, this is the first time I'm seeing the tool. And I think it's really quite useful. Looking at the current projects we have across the Pacific Island countries, some of them have IT components. And I think, as Leroy has mentioned, sometimes it's just seen from the end user perspective, but I like how this assessment looks at more upstream issues as well, and how the assessment is done. So I think looking at the current projects, also future projects, it's something that I think will be very useful in looking at health projects, and it's particularly for digital health. So thank you for this, Katri. And also, while I still have the floor, will it be possible, Dr. Teng, if you could share your presentation?
Yes, I'm sure this will be recorded, you know, but I can share the presentation itself, but this will be recorded as well and made available.
All right, thanks. That's it from me.
Yeah, no, I mean, I'd be good to, do I call you Mesu?
Yeah, Mesu is fine.
Mesu, yeah. I mean, yeah, what you suggest is, you know, kind of in terms of thinking about that in how we can frame our future projects, you know, from a country basis as well as a regional basis, along the lines of how we improve not just the digital system, but also along the way, our own levels of maturity. You know, they intertwine. And I think that's one way to look, a good way to look at it, in the sense that you're thinking about how you improve yourself as well as the health system. The important thing that came out, one of the important things is, you know, there's an absolute lack of staff, lack of qualified staff to do this work. Yeah, and you know, and Leroy is a very good example. He's a dental officer, but he's kind of leading some of the digital health stuff, you know. And Tarao is a good example. He's a computer scientist, but he's also leading some of this digital health stuff. You know, I think to my mind, this is one way we need to be looking at this capacity problem, which is looking at multi-skilled individuals. Doesn't matter what their background is, but you know, building a capacity and training them and supporting them to support the digital health system through all the levels of maturity.
I think, Dr. Teng, as well, that, you know, like now we are doing the regional analysis, you know, like, you know, the cross, the bringing together all these individual country assessments. We might, you know, like, you know, the very well, you know, to see, you know, the common denominators and common problems.
Yeah.
And that would be the one of the beauty, you know, like, you know, for instance, with the development partners together with the countries, you know, they're doing some prioritization. I know that, you know, like ADB and the World Bank, they're doing very important, you know, the work, you know, the building the base infrastructure in the countries, but also these profiles can give you, you know, some guidance, you know, also, you know, like, you know, what could be, you know, the good business case, you know, like for you to start with, the better connectivity, for instance, like if the country prioritized, and, we will see, like that there's a lot of the potential, the build and use, for instance, the telehealth, the applications, the based on the better connectivity, that was increasing in the countries, like we would be able to do some joint planning to using these profiles. So that, like would be, like my envision, like, how to make these profiles, the work, the regional, but, the individual country level as well, bringing, the countries leading the planning, but, also that, that across the partners and technical agencies, that take the great benefit for existing tools. So you don't have to start collecting, from the scratch, like always information, to understand what's happening in the country.
Yeah, totally agree.
Yeah.
Are there thoughts from anybody else on how we can strengthen this process, but also take it forward?
I think Christine wanted to say something before, or she had put her hand up.
Hi, Dr. Tan. Hi, Katri. Katri, I completely agree with you. One of the problems that we're facing in the Karak regions and Caucasus as well is the difficulty it is in sharing people's status in terms of the digital health readiness. One of our goals is to be able to begin piloting particular solutions or applications to better support COVID-19 mitigation and containment measures. But we also at the same time need to be able to match those applications to a country's digital health readiness as well. Yeah. So this tool is really important for that. But also being able to share the challenges for implementation, being able to share how a country then is able to further strengthen its digital health strategy and also its digital health landscape is really important, because we strongly suspect that across these countries there are shared challenges, and so this is an ability to be able to begin dialogue across countries to be able to further collaborate amongst each other so that we can start to build a strong foundation for a collaborative approach to strengthening a digital health landscape. So thank you so much for your presentation, and Katri, thank you so much for inviting us.
Thanks for that. Thanks, Christine. But I think there's the digital age has has spawned the crowdsourcing and a crowd creation concept, which is really good in the sense that, we're talking about international, the region and in the Pacific Islands as a starting point to have a coordinated approach and therefore getting more bangs for the bucks. Over. We got about 5 or 6 minutes left. Any final comments from anybody?
Hi, Dr. Tan, this is Giovanna. So thank you so much. This is very useful. It's the first time I get to know about this tool. So I appreciate really it's great that countries are putting in place these strategies. I'm very interested. I just want to mention, just based on the experience on implementation of CoData, which is a contact tracing tool. Basically, the main hurdle is what you mentioned, the lack of unique identifiers, and this is upstream of a problem that, like, even if you don't use a digital tool, this is still a problem. Like, you can use paper-based and Excel, and still not having a unique identifier remains a huge challenge to actually connect all the data sets. So that's one thing I wanted to mention. I think it's really great if there's in the tool this strategy of a unique identifier for the patients. And then number two, I agree with lack of understanding. So often we get requests for implementing the software. And when we get to talk to the country, we realize that there is really a lack of understanding of what are the challenges of implementing a digital tool. So all the upstream assessment of resource, what's the IT infrastructure that is available, for example, to the country, the staffing, but also the lead for the implementation really needs to be comfortable with both health and IT. And it's not so easy always to find the appropriate person that has like this both backgrounds. So it's always good to have a consensus with, for example, in particular in GoData, to have surveillance and IT professionals that are working together, because it's really it's rather a new way of working, right? And there's a lot of considerations of interoperability, and this is not something that, for example, as the epidemiologist, by default, we are comfortable with and we understand the jargon. So I just wanted to mention this. And then about the community and experience sharing. For GoData, we have a GoData community. And when we train several countries, the main point is for them to connect with each other, for example, in the region, and they can share their experiences so that they learn from each other. Thank you very much. Over.
Thank you. Katri, any comment on that?
Well, the being, the part of, on the GoData implementation in the Pacific, I think this is a great example of how now in the COVID-19 situation, there was a great need, to have digital health case and contact outbreak investigation tool, for the contact tracing and data analytics. However, a lot of countries were willing, that they said they want to adopt the tool, but, we have encountered a lot of difficulties, like with the implementation, because, there's no base foundations. Alexander just dropped out, from Friends for Indonesia, but, he gave, like, for instance, an example is that how they needed to create, the ad hoc unique health identifier for to implement the GoData. So I think that, in peace times, the tool would be very good pre-assessment tool, to look, like whether the country would be ready and mature enough, and what scale of the implementation would be possible for the different kind of tools. So, because now, like, for instance, Giovanna and GoData team, they have spent a lot of time, actually hours, just try to figure out, how they could implement it. And usually, a lot of these issues were discovered, just by using the country digital health profile. You need a certain level of internet connectivity or a national data server or this kind of stuff, in order to allow the GoData, to function as it was meant to in a full scale. Over to you.
Thanks for that, Katri. And in the last couple of minutes, anything you want to add to this, Tara or Leroy?
Thank you, Dr. Chin, and everyone. I have nothing to add from here, but I see, how we progress with this framework from your hand. Thank you.
Thank you. Leroy?
No further comments, Dr. Tang. Just thanks for the presentation and the discussions. Cheers.
Okay. Well, I guess this 11:29, so we in the last minute. So this has been a really, really fascinating discussion and really insightful from different perspectives, and that's really great. We'll reflect on this recording and come back and see how you can improve the way we're doing things right now, and draw some guidance for future of this this particular program. And yeah, and all I can say is Thank you very much. And that we will share the slide decks after this. And
May I just add, Dr. Teng, that, like we continue to support, we continue this project and this work. This is not, just creating the profiles, the maturity assessment, like, so countries that are interested to work with the Dr. Teng and eHealth Collaboration Center and WHO to look, how to apply, like these tools for the national planning or some specific, like it could be even the sectoral planning. They can contact us and, like we can look, how we can provide that, the assistance for the countries.
Thank you very much, Katri. On that note, so as Katri says, we're here to help. We're the government, we're here to help, for one of better. So thank you very much for your participation, everybody. And we'll look forward to hearing from you again.
Bye.
Thank you very much.
Bye.
Thank you.
Thank you.
Thank you. Bye.